You're welcome to my channel. I will quickly go over the effects of caffeine on diabetes mellitus. Not good and good. Let's see. High caffeine is not good. It's not good for anyone diagnosed with diabetes mellitus. What is good then? Moderate amount of caffeine is good. And why that? It has high antioxidant effect, and with that, there will be decreased inflammation. So moderacy is what we're preaching here, okay? Sources of caffeine. You can get that in kola nuts. Some just buy kola nuts, buy, chew, and swallow. Cocoa beans, tea leaves, coffee. That's pretty common, right? Coffee, chocolate of all forms, guarana berries. The list of sources of caffeine will include cola, that is like Coke, the soft drink you take all the time, right? Energy bars, cough syrups, slimming tablets, iced tea, and Tylenol extra. Diabetes mellitus and high caffeine will lead to what? When there's highly concentrated caffeine, insulin resistance will be on the increase. And you know what that means to type 2 diabetes mellitus. Also, the rate of insulin production will drop. Okay, then there will be decreased adenosine, and adenosine is actually helping the diabetic patient because adenosine will enhance insulin sensitivity. So when there's high caffeine intake and the level of adenosine drops, then that enhancement of insulin sensitivity is lost. Also, when there's high caffeine, there will be decreased glucose utilization after feeding, that is, decreased glucose utilization postprandial. Increased catecholamines will be experienced, that is, increased epinephrine or adrenaline, depending on where you are, norepinephrine or noradrenaline, depending on where you are. So they will just be released into the circulatory system, and that means there will be increased glucose. And also, when you take so much caffeine, you can have insomnia. Insomnia will lead to decreased insulin sensitivity. Moderate level of caffeine will not give us all this trouble listed above. Now, how can we prevent the problem associated with too much caffeine, then leading to high blood glucose, leading to the sequelae? Number one, you can reduce the volume of the coffee or the caffeine you are taking, or reduce the frequency, or do both, which means reduce the volume and at the same time reduce the frequency. Or if you can't do without that, you can take decaffeinated. But remember, decaffeinated also has some level of caffeine, though very low. That is why we will advise here that you also take decaffeinated moderately. Decaffeinated will give you less hyperglycemic effect anyways. Then lastly, when you want to prevent this, you can check your blood glucose level after drinking that coffee to know how much glucose has risen above the normal level expected. Then you can use that to determine what volume, the number of cups of coffee you can be taking per day, and that will be appropriate for you. So you can be your own doctor on this issue, right? Now, how do we treat this if that is a problem? It is difficult to prescribe a certain amount of caffeine or coffee, now for anyone. Why that? The body mass index is not the same. So somebody with bigger body mass index might take 2-3 cups and will not have the same effect as someone with lean body. And of course, the rate of drinking, I mean the tolerance, so some can take coffee large number of cups or large amounts and they have less effect compared to someone who doesn't take it all the time and will have much effect on them. So frequent drinkers are different from occasional drinkers. The general impact, if we don't take to all this, in anyone diagnosed with diabetes mellitus, particularly type 2, the diabetes will be very difficult to control. There will be more complications of diabetes mellitus, microvascular and macrovascular. So they will come down with retinopathy, kidney nephropathy, kidney problems, come down with ischemic heart disease, heart attack, high blood pressure, more and more poor morning, and so on. There is likelihood of increased need of interventions. For example, when the glucose level is shooting up all the time and the medication is not unlinear because there's more insulin resistance right now, so they'll be ending up in emergency room with hyperglycemic coma and all other possible complications. And there'll be need for more medications, right? And finally, that could lead to death. Because if someone has diabetes mellitus and you follow the pieces of advice and you're taking your medication, it's possible that you can bring the diabetes under control, lead a normal life, and die a natural death after. But over a long time, with glucose that is difficult to bring down, difficult to control, you run into all complications of diabetes mellitus, micro and macro, and can lead to death. With that, I've come to the end of this short presentation as per Caffeine and diabetes mellitus. Just moderate use of everything. Thanks. Remember to share this with your friends. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. I appreciate it.